It is noon, Laura. You are good to go.
All righty. Good afternoon, everyone. Welcome to the August 22nd, 2022 edition of the St. Lawrence County Chamber's Lunch and Learn webinar series. I'm Laura Pearson. I'm the Workforce Development Coordinator at the St. Lawrence County Chamber of Commerce, and I'm the Executive Director of the Greater Ogdensburg Chamber of Commerce. This monthly educational webinar series is made possible by the generous support of St. Lawrence University and Clarkson University, who are leadership circle supporters of the Chamber and make these webinars possible. I would like to thank Executive Director Ben Dixon, who is my tech manager for this webinar. Before I introduce today's presenter, I want to run through a few items. First of all, your mics have been muted and your webcams have been disabled. But if you have any questions throughout the presentation, feel free to type them into the chat window and we will do our best to answer them. Please note that this session is being recorded for the purposes of broadcasting it on our webinar archive and YouTube channel, which is named the SLC Chamber NY. After the presentations are complete, we will stop the recording for any Q&A. We do keep the webinars to under an hour so you can get back to work. Are you interested in presenting? Please contact us. I would like to introduce our speaker or presenter for today. Our topic today is workforce wellness and mental health at work. I am therefore pleased to introduce Crystal Rowley, Prevention Educator and EAP Counselor from Pivot, located in Watertown. Crystal will discuss workplace wellness and how businesses can reduce the mental health stigma in their workplaces. Welcome, Crystal, and so the floor is yours.
Thank you for having me. And I'm actually always very excited to share about, mental illness. And that sounds kind of weird that I'm excited about it, but because it's something that people shy away from talking about and don't realize that, it affects so many people and so many people that you employ at your businesses, and, exactly what it is and what we can do to kind of help our employees who are dealing with some mental health issues. Really what I'm going to try to focus on is mental wellness, and then we'll talk a little bit of the mental illness part of it. So I'm going to share my screen and going to hope that it's going to come off with no issues here. Let's see here. Everybody see that? Okay. So mental wellness in the workplace is what we're going to cover today. As it was mentioned, I am a prevention educator and employee assistance counselor. We work with businesses, organizations, non-for-profits in St. Lawrence, Lewis, and Jefferson County, and we provide counseling for businesses who contract with us. And it's a free service for your employees, but we contract with the business itself to provide those services. And generally, employee assistance counseling is a short-term, solution-focused counseling. So we always say that short-term is very subjective. I work with my clients as long as we have a goal and we're working towards that goal. And I feel that clinically we're doing work well together. I am also a master's level intern and working on my master's of social work. So I have a little added benefit of I have a better understanding of the mental illness part of things when it comes to diagnosis and treatment and stuff like that. So that's me. That's Pivot. If you do not have Pivot hooked up with your workplace and you're interested in hearing more, you can for sure get in contact with me, and then I would get you in contact with our supervisor, either Kelly or Bill Bowman. So we're going to move right on. Okay, our learning objectives today. Yes.
Crystal, can I jump in? One, I don't know, it looks like you may have your kind of notes version.
Can you see the note there?
Showing.
Okay, so it's supposed to be presenter view.
Okay. That's always a funky thing on Zoom with displays. The other thing is, I assume you will share your contact information for those who do want to follow up.
Yes, I can share that. When I'm out of presenter view, I might just put it in the chat if that's okay.
That sounds good. I'll throw it in for you even.
Okay. So I am going to stop stop the share real quick, and I will take it out of my presenter view and take the notes away. I think I can do it without the notes. Okay, how does that look? You good? Okay.
Yes, great.
Okay, so I have a couple of objectives today. I will say that this is kind of short and sweet. I wanted to provide you with good information, but I didn't want to take you, all your lunch. So my learning objectives for today is to define mental wellness and why it's important, and then identify mental health concerns in the workplace, and identify habits that create mental wellness in the workplace, and then identify resources and tools available for those things. Let's see. Okay. I'm just going to share a brief video. Some of you may have seen this before, but I really like it.
So we're from Wayne County Public Health.
Right.
We're just asking some questions.
With a fryer, you have to have a first aid kit in case the oil splaps on somebody.
I think it's good to be prepared, whether for yourself or for people you're with. So you're prepared for the worst.
Well, in case you have an injury and you can't get to a hospital soon. Water, food.
Iodine, bandages.
Burn ointment for us with oil. See ya, Band-Aids.
Of a number of bandages, Band-Aid stuff, and
Antibacterial stuff.
ammonia things or something to bring somebody back. Ointments.
Maybe like Benadryl or ibuprofen in case someone's having an allergy attack.
In a mental health first aid kit.
Mental health first aid kit.
In a mental health first aid.
I've never thought of that before, but
Isn't it time you gave your mental health as much thought as your physical health? Build your mental health first aid kit at mindyourmindproject.org.
Right. So the idea there is that we think about our physical wellness. We think about like emergencies when it comes to our physical health, but do we really look at our mental health, and do we really realize that we can have mental health crises, and that if we're not taking care of our own mental health, we're going to go into crisis, and we're going to look at some of the dimensions, the wellness dimensions that are going to help us from having mental health crises. But and we will look at the end of the presentation. I will try to give you some tools as well to really put into your mental health first aid kit. So there's a big definition of what mental wellness is, and it's a lot of things. Really, what I like to look at is the fact that mental wellness is wellness in these 8 dimensions. It's emotional, so respecting, knowing, understanding your emotions and your loved one's emotions. Environmental, having secure and safe housing, pollution, crowded areas versus suburban areas. Like, it's all of that stuff. Financial, are you financially secure? Are you spending more than you bring in? Is your job paying enough to pay your bills? Intellectual, are you being challenged intellectually? Are you growing? Occupational, are you in a job that you find fulfilling and it's a passion for you? Physical, our physical health has a deep impact on our mental health. So if you're unhealthy physically, mentally, it can be a drain on you. Socially, we are social beings, so we need that interaction and that support and that communication. And then spiritual, and this is any kind of spiritual, it's important to have some kind of connection to some kind of spiritual, whatever is important for you. So those are the 8 dimensions of wellness. And what we find is that if any of those 8 dimensions of wellness are off, we can experience a mental health crisis, or our mental health can start to deteriorate. The impact of neglecting mental wellness. These are some statistics. 81% of our employees report the stress from their job affects their relationships with their friends and family. We have employees who are bringing the stress of their job home, and it's affecting their relationships with their friends and their families. To the point that, you know, we're seeing divorce, we're seeing issues with, you know, parenting with kids, and you know, and not wanting to engage outside of work with our friends because we're so stressed from our workload. We're bringing the work home with us. And so the stress from the job is definitely going home with your employees, and it is having an effect on their mental wellness. 63% of the employees report the stress from their job has resulted in them engaging in unhealthy behaviors. Unhealthy behaviors are anything from drinking too much, engaging in substance use, acting out in physical or verbally when it comes to relationships, you know, more of the you know, behaviors like driving too fast, risky behaviors is what I'm looking for here. So the stress from their job is resulting in them engaging in those unhealthy behaviors. And 71% of those employees that are thinking or saying that, like, you know, I'm bringing my stress from my work home with me, are actually thinking about or actively looking for new jobs. And 65% of employees report being distracted more than 30 hours a week due to a hostile work environment. Think about that, more than 30 hours a week due to a hostile work environment. So what I'm going to advocate for is that we very purposely set up a work environment that is not hostile, but is stigma free of, you know, judging people because of mental illness or anything like that. And, you know, before I move on to the slide, I do want to bring up the fact that, so a lot of people, I think if you don't experience, you know, depression, anxiety, or whatever, you think, oh no, that's just other people. You know, according to the National Alliance for Mental Illness, 43.8 million adults experience mental illness in any given year. So that means about 1 in 5 adults experience some kind of mental illness. 1 in 25, so about 10 million adults, Americans live with serious mental illness. So we're looking at schizophrenia, we're looking at bipolar, we're looking at personality disorders, what are serious mental illnesses. So just to give you kind of a breakdown, these people are in your workplace, okay? And some of them aren't getting the help that they need because they're afraid to reach out. They're afraid of being judged, they're afraid of the stigma. So the cause of poor mental wellness, disruption in schedule, something like, you know, somebody's work schedule is getting turned around all of a sudden, and, you know, it is disrupting their babysitting for their kids, it's disrupting their rides to work, something like that. That could cause poor mental wellness. Unable to do preferred activities, weather. We all know, living upstate New York in the wintertime, sometimes it's hard. We don't see that sun for a week at a time. That can have effect on our mental wellness. Fear, anxiety, worry, family, marital concerns, increase in workload can definitely have an effect on it. And, you know, this day and age, COVID, many people are still very worried about COVID, and you rightfully so. And then close ones getting sick. These are all things that if we see a disruption in these kind of all fall under the 8 dimensions of wellness. If we see a disruption in these 8 dimensions of wellness, we're going to see a deterioration in mental wellness in general. Okay, so what that means for the workplace, implications of poor mental wellness in the workplace. Absenteeism, I'm sure, is something that we all find in our workplace. So we're going to have missed work days. You're going to find those people calling in sick, and they really don't have a reason. Maybe they say they don't feel good, but it's just they can't get out of bed, they can't do it, or they wake up and they can't do today. And there's no way to share that with somebody when you feel like you're going to be judged. You're just saying, you know, I feel so depressed, I can't get out of work today. How does it make you feel when you think about, I'm going to tell my boss that? Presenteeism, which is reduced productivity at work. So they are showing up for work, but they aren't there. And when they're not there mentally, they aren't getting the work done that they're supposed to. It's going to cause people to be kind of on edge with each other. So they're going to notice that their coworker is off, and maybe they're depressed and they are, you know, kind of snippy with their coworker. It's going to cause some kind of conflict between the two of them. Become passive, turnover. You're going to see people leave, you know, less caring and apathetic. So those are what it looks like in the workplace. What can we do to create mental wellness in the workplace? I will always be a big advocate of reducing stigma and having very clear and non-judgmental HR policies when it comes to mental illness in the workplace. So, you know, when you're onboarding somebody, you make sure you're talking about, you know, the health insurance. Oh, you know, if your health insurance that you provide to your employees covers that mental, that covers therapy, medication, stuff like that, point that out. If you offer employee assistance programming for your employees, make sure they know how to get into contact with that counselor, and make sure that they know it's free to them, and make sure that you make it known to them that you're going to work with them to find a time where they can have counseling at least once every other week. And if that means that it's during their work times, you're willing to work and kind of flex their schedule to work that out. That is reducing the stigma. That is you as an employer saying, I understand that sometimes you get sick in your physical body and sometimes mentally you get sick, and we're going to help you. So be very upfront from the start of the, you know, employment with your employees. And then we're going to create a supportive environment. So we're going to crack down on bullying. And I know sometimes it seems silly to talk about as adults, but it happens. You know, you do strict anti-bullying, strict gossiping type policies, because that has an effect on our employees' mental health. When we know that people are talking back and forth behind our back, it makes us feel less than. And then you come up with programs, and this is where EAP can be helpful for you. You come up with programs that help strengthen family and healthy work initiatives. So with Pivot, a lot of our companies will come to us and ask us to do training on stuff like, you know, how to create a better work-life balance. They'll do trainings on stress reduction and mindfulness and stuff like that. They'll do trainings on parenting for their employees and make it available for them. And that just shows that your employees, that you're interested in not only them showing up and doing their job, but understanding that if they're healthy in body, soul, and mind, they're going to show up and they're going to be present and they're going to do a good job for you. And strengthening workplace and communities to take action, peer support, work-led initiatives. So there again, the stigma needs to be reduced. So the peers on the job can talk about, hey, I'm utilizing the EAP program. I see that you're struggling. Why don't you reach out, kind of thing. And then what's healthy is when an organization, if they have the time and the resources to work together as a unit and do some kind of community outreach as an employee, as a business, if that can be worked out. And then develop personal skills, life training skills, mental illness literacy, parenting skills, financial management, that kind of goes with what I had talked about before. You know, having those kinds of trainings, those kinds of, you know, maybe even materials available for your employees when they're saying, hey, I need more training, I need more knowledge on this. So healthy wellness habits. So encourage employees to utilize their employee assistance program. Again, you keep reminders, you give it to your employees as you onboard with them. Keep reminders in the break room, have brochures available, make sure supervisors know how to get in touch with the EAP counselor. Practice self-care. Self-care can look like a lot of different things. Self-care looks like hiking for somebody who's an avid hiker, looks like going to get their nails done for somebody who likes to do that. Self-care looks different for everybody. Self-care looks like therapy. Somebody might even be mentally well. They might not even have a mental illness, but they feel like they need somebody to talk to on an ongoing basis. That's self-care. Encouraging activities outside of work. Life needs balance, and life is not fun if all you do is work. I will always tell my employees, that you need, I'm sorry, not my employees, my clients, that you need boundaries. And when it comes to work, as long as there is not some looming deadline that is absolutely crucial for you to get done, when you're at home, ignore those emails, ignore those phone calls as much as you can, and prioritize what needs to be prioritized when you're at home. I'm all about healthy work-life balance, and so I'm sorry if any of your employees are my clients who I say don't answer that email until Monday morning at 8 o'clock. And I practice that myself, barring any kind of absolute emergency on my client's behalf. My emails, my text messages get answered when I'm working, again, unless there's a crisis. And stuff like practice gratitude, deep breathing. We do a lot of training on guided imagery, mindfulness, deep breathing. A lot of people feel like those are like, just kind of words that are thrown around and like nobody really quite understands what they are, but they're all very good tools to implement when you're trying just to be healthy in general. And then taking care of physical health, when employees encourage your physical health, like initiatives like we do Biggest Loser programs at our work, and we give tips on healthy living and healthy eating and stuff like that. Again, that's showing the employee that we care about you as a whole person, not just as what you can do for us as an employer. So I forgot I did have that slide on here. We do have 2 locations. We are located in Watertown, and we do have 1 EAP counselor in Ogdensburg. And if you are in St. Lawrence County and you have EAP services through us, we do Zoom and telephone appointments too, if that person is just too far for them to drive to Watertown to see us or to Ogdensburg to see us. If your organization or company is not already connected with us, feel free to go to the website, and there's a contact button that you can get more information. You can request more information, I should say. And that is all I have for this presentation.
Thank you so much, Crystal, for your time and sharing your expertise with us today. Thank you all for joining us today. I hope this hour was valuable to you and provided useful information on how you can be more physically and mentally healthy at work. I would like to also thank Clarkson University and St. Lawrence University for their support in sponsoring this webinar series. Follow and like our Facebook page to stay up to date with what's happening at the Chamber and to register for our next webinar. The topic of that webinar will be released soon. We encourage you to view our other webinars in the Lunch and Learn series by going to slcchamber.org and clicking Archived Webinars in the right-hand menu, or go to our YouTube channel, search for SLC Chamber NY. Also, if you know of any businesses that would benefit from membership in the St. Lawrence County Chamber, please do refer them to us. We can be reached at 315-386-4000 or at info@slcchamber.org. Interested businesses can also learn about our benefits and apply for membership at www.slcchamber.org. Thank you again for joining us. Have a great afternoon and safe, wonderful summer, everyone. We're going to stop the recording now and open up the floor for questions and answers.
Thank you.
Okay.
I did